I'm Joylene Rojas, and in this video, I'm going to demonstrate range of motion exercises that are performed by patients themselves or by a nurse in case of helpless patients to mobilize all joint through their full range. Range of motion are those in which a joint is moved through its full range of motion according to its capacity. There are two types of range of motion, the active and the passive. Active is done by the patient himself, while the passive is done with the help of assistance from another person. Pre-procedural steps. Remove all tight clothes and provides a hospital gown or loose clothes. Cover the patient with sheets and assist in assuming a supine position. Explain the patient purposes of doing exercises. Provides privacy and wash hands. Expose only the area that is being exercised. Start providing range of motion from head downward. For the neck, move head through flexion, extension, hyperextension, rotation, lateral flexion. Movement of head is contraindicated in supine surgery, spine trauma, and patients having central vein line. Okay, for the flexion, extension, and hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. For the neck rotation, for the lateral flexion, for the shoulder, we are doing flexion, extension, hyperextension, abduction, adduction, circumduction, external rotation, and internal rotation. Shoulder should be supported proximally and distally. So, for the flexion, okay, flexion, extension, hyperextension. Okay, for the abduction, abduction, adduction, abduction, adduction. For the circumduction, for the external and internal rotation, okay, elevation and depression. Okay, elevation, lifting shoulder toward ear. Okay, depression, lower shoulder toward hip. Depression. Elevation, depression. Elevation, depression. Elevation, depression. For the protraction and retraction. Protraction with arm, okay, like this, at shoulder level. Okay, keeping elbows straight. Reach forward as far as possible. Okay, and for the retraction, using same position, draw arm and shoulder back as far as possible. Okay, protraction, retraction, protraction, retraction, protraction, retraction. For the elbow and forearm, okay, for the elbow, flexion and extension. Flexion, extension, flexion, extension, flexion, extension. Okay, for the forearm, pronation and supination. Position wrist in functional position. Okay, we can make it like this. This is supination, pronation, supination, pronation. You can make it also like this. supination, pronation, supination, pronation. Okay, and now we are doing flexion, extension, abduction, adduction, and opposition of thumb for the hand. Okay, just like this. Okay, wait. Okay, this is okay. Abduction, adduction, abduction, adduction. Okay, for the flexion, flexion, extension, flexion, extension, flexion, extension. Okay, for the position of thumb, just like this. Okay. For the trunk, flexion, extension, hyperextension, lateral flexion, and rotation. Okay. Flexion, extension, hyperextension, flexion, extension, hyperextension, lateral flexion, for the rotation. Okay. For the hip, flexion, extension, abduction, adduction, internal and external rotation. Okay, just like this. Flexion, extension, flexion, extension. Okay, and then abduction, adduction, abduction, adduction, abduction, adduction. And then external rotation, internal rotation. Okay, external rotation, internal rotation. External rotation, internal rotation. I'm doing passive range of motion for hip and knee. The flexion and extension, abduction and adduction, and inward and outward rotation. Okay. Support the knee and ankle. Okay. Flexion, extension, flexion, extension. Okay. For the abduction, adduction. Okay. Abduction, adduction. Okay, for the inward and outward rotation of the knee, just bend the knee. Okay. Support here and here. Gently. Okay, rotate. Outward, inward, outward, inward. Okay. Okay, after the procedure, wash hands, make patient comfortable, record procedures. Special considerations: move each joint through its full range of motion exercises 3 times and follow regular pattern of movements. Provide passive range of motion exercises 2 times a day. Support measures should be used to prevent muscle strain or injury during range of motion exercises. Thank you.